If you have a family member or a loved one that you think might be depressed, it's very important to maybe support them into some form of treatment for depression. What you can do is you can offer them some information on treatments that are available. Don't stigmatize them, don't tell them they're crazy and that they need treatment, because that's going to make them stand back and they're going to say, no, I don't, and they're going to try to prove to you they don't need it. So be more understanding, be more gentle with them. Say, you know, this has helped other people, and I'm wondering maybe if you might get some help out of this. You might want to tell them the benefits that they might get out of doing some kind of treatment. You might tell them you've noticed the change in their mood, and maybe they might feel better doing this. Give them hope that treatment can be helpful for them. Show interest in their entire life, and not just interest in getting them into therapy, but interest in their whole life, and that could be helpful in getting them to take the next step to go into therapy. Now, there are people that you might want to help get into therapy that could be very resistant to going in. And they may see therapy as something that wouldn't be beneficial to them, or they see it as a stigma that they don't want to have on themselves. So what you want to do with those people is you want to destigmatize it. Again, you don't want to blame them for having a problem, but just coaxing them and telling them, look, this has been very helpful for other people. It might be helpful to make the appointment together with them and go together to the first appointment so that they might feel a sense of safety with you and stick with some form of therapy. When someone is particularly resistant, you want to show them the benefits that they can receive from therapy. The benefit to themselves and also to their families, because oftentimes people do want to do the right thing for their families. So if you can point this out, show them the benefit, they might go along with this. But more than anything, you want to empathize with their situation and not blame them and make them feel like they are a problem or they're part of a problem. Help them see that there's a solution and help them get into it. However, some people will refuse to go into therapy no matter what. And you can only do what you can do. So know what your limits are and what you're willing to do to help somebody get into therapy as well. And at a certain point, if they're so resistant, there's nothing else you can do. You're just going to have to let them be. There's several forms of treatment that people can take to help themselves get out of depression. One is going into counseling for what's called psychotherapy. And in psychotherapy, you have marriage and family therapists, you have licensed social workers, psychologists, and psychiatrists who can all perform talk therapy with people. Now, psychiatrists are the only ones that prescribe medications. And medications are another avenue that people can take for treatment of depression. However, if you're going to take medication, it's always best to also be in psychotherapy and talk therapy at the same time. Frequently, people are prescribed antidepressants and they're not taking any form of treatment. Antidepressants have a lifespan in which they can work. They will work 3 to 5 years and then they don't work as well after that. So you have a window of opportunity where you can get some work done while they're working at their maximum. And that's when you want to go into therapy and be working on your issues so that when you come off of antidepressants, you have the tools and the skills necessary to move yourself forward in life and to overcome the depression. Too often people rely on the antidepressant as the thing that gets them over depression. It's not the only answer. Now, many times people can overcome depression just on their own. They don't need to have medication. They can do it through talk therapy, they can do it through exercise, they can do it through other means of overcoming depression. But it's important to know that you have these resources there, both psychotherapy and medication, and sometimes the two in combination. For more information on depression, you can go onto my website at LAtherapist.com, and for self-help, you can check out my other website, which is hypnocd.com. I'm happy to answer any questions that you have.